We, the Center for Global Development, we're a group that try and see how we can make the international system that supports global development work more effectively.
How do we finance infrastructure in the poorest parts of the world? How do we increase productivity in agriculture? What kind of policy brings out the best outcomes?
What CGD is about is you can ask those difficult questions that people refuse to ask and actually find solutions.
We're thinking about how climate change will impact migration patterns, how that will in turn have impacts on people's health.
It's challenging to be able to align budget with ambitious programmatic goals, but it can be done.
If you can help to make things a little bit better, that's a good way to spend your time.
Greetings and a warm welcome to the event on Aging Well in Asia. I'm Sanjeev Gupta, Senior Fellow Emeritus at the Center for Global Development, and I'll be moderating this event. Good morning to those who are joining from the US, and a good evening to those joining in from the Asia. I would like to thank our distinguished panel for joining the conversation at this late hour in Asia to discuss the newly released policy paper on aging by the Asian Development Bank. Our dialogue takes place against the backdrop of several significant emerging trends. Firstly, fertility rates are declining, and projections suggest a gradual decline in global population. This demographic shift holds the promise of elevating overall population pressures, thereby potentially curbing the use of fossil fuels and offering environmental benefits. Moreover, countries may have more resources to allocate towards social sectors, thereby enhancing living standards for their populations. Secondly, at the same time, longevity is increasing, resulting in the rising ratio of elderly to young population, what we commonly call dependency ratio. By 2050, this ratio is expected to double in Asia. This demographic transition is occurring amidst lower per capita incomes in developing Asia compared to when advanced economies began to face similar demographic challenges. Thirdly, old age poverty remains prevalent in Asia, posing significant challenges for policymakers in the region. Fourthly, the aging population in developing Asia is accompanied by an increased prevalence of non-communicable diseases such as cancer and diabetes. Moreover, factors like prolonged illness, social isolation, and economic insecurity are contributing to a higher incidence of depression among this demographic group. These developments have profound social and fiscal implications as countries grapple with increased expenditure on pensions and healthcare without well-designed policies supported by revenue enhancements. These programs risk exacerbating public debt levels. Additionally, raising tax rates to finance this program could potentially dampen economic growth. Thus, policymakers must navigate these challenges while also addressing the impact of shrinking labor force on economic growth. So against this backdrop, we gathered today to discuss the insights offered by the new policy paper released by the Asian Development Bank. This paper delves into some of the challenges that I've just enumerated at the outset of my remarks. To kick off our discussion, Dong-Hyun Park, who is one of the lead authors for the paper, will make a short presentation. He is an advisor in ADB's research department and managing editor of Asian Development Review, which is ADB's research channel. Dong-Hyun, the floor is yours.
Thank you so much, Sanjeev. So as Sanjeev just mentioned, ADB just launched a new annual flagship report called the Asian Development Policy Report, or ADPR. It's based on this more than 10 more than 15 actually background research papers. So it's a substantive report, and we will be producing one every year. And the very first or inaugural Asian Development Policy Report, or ADPR, happens to be on the topic of aging well in Asia. Now, this ADPR 2024, Aging Well in Asia, explores three interrelated issues. One, the state of well-being of older Asians. Two, whether the region is sufficiently prepared to age well. And three, how the governments of Asia are responding to the rapidly changing demographic landscape. Different economies in the region are at different stages of population aging, but it is important to note that the demographic transition or population aging is happening even in the region's relatively younger countries. So population aging is an Asia-wide phenomenon, region phenomenon. And the major strength of our report is that we use a new or novel micro data set, and we do most of our analysis based on that new novel micro data set, which is based on compiling, harmonizing, and merging 9 country-level surveys on population aging. Those 9 countries, Bangladesh, India, PRC Korea, 5 bigger ASEAN countries collectively account for around 84% of developing Asia's population. Next, please. Next slide, please. No, the one before. So we have 5 key messages from this year's Asian Development Policy Report. First, developing Asia is aging rapidly, and to a large extent, that's a good thing, right? Because it reflects our region's development success and consequently rising longevity. But the bad news is that the region remains largely unprepared to cope with population aging. Secondly, because we are largely unprepared and because population aging is so rapid in developing Asia, an urgent policy throughout Asia is to promote the well-being of older Asians. Third, there's wide inequality when it comes to well-being of older Asians. In particular, older women are more disadvantaged, and older rural residents are more disadvantaged. Fourth, among the different dimensions of old age well-being, the most important is health, right? Because it affects productivity, it affects economic security, and it affects social engagement. By the way, the 4 key dimensions of old age well-being are health, both physical and mental health, productive work, economic security, and social engagement. And fifth, developing Asia must step up its efforts to help Asians age well through a lifelong approach, a life cycle approach, and a population-wide approach. Next slide, please. Next slide, please. So as you can see on the left-hand side, developing Asia is in fact aging rapidly. From 2022 to 2050, the share of older Asians, that is Asians 60 and above, is expected to roughly double to 25.2% of the total population of Asia. And that's approximately 1.2 billion people. And then as you can see on the right-hand side, which shows the two time periods in which the share of the 60 plus population shifted from 10% to 20%. It varies from country to country across Asia, but it is happening across all of Asia. Next slide, please. So as you can see, how is Asia doing? Well, across these 4 dimensions, as I said earlier, we are fundamentally unprepared. So for example, 50% of older Asians are affected by non-communicable disease or lifestyle diseases and up to 60% of older Asians did not attend regular health checkups. And you can see all these vulnerabilities across the other dimensions as well. We are unprepared. That's the bottom line. Next slide, please. But there are many things that the governments of the region can do to prepare the region better for an older Asia, for old age well-being in Asia. And these are just some of the policies that the report highlights. So again, I strongly urge everyone, the audience, to read the report. Asian Development Policy Report. It's the very first first edition or inaugural edition of the Asian Development Policy Report. Thank you, and back to you, Sanjeev.
A very precise presentation. You have set the stage for our discussions today, and before we proceed further, let me introduce the three other panelists who will join you in the discussion. First, we have Eduardo Klein, who is the Regional Director for East Asia and Pacific, HelpAge International. Previously, he has taught in Latin America and researched at Oxford University. We also have Professor Norma Binti Mansour, who is Director Social Wellbeing Research Center, University of Malaya in Malaysia. She's also Deputy Vice Chancellor at the university. Then we have finally Professor Pauline Tay Strawn, who is Director, Center for Research on Successful Aging, Singapore Management University. She's also Professor of Sociology at the School of Social Sciences and the Dean of Students at the university. So before I go any further, I would like to make a short announcement for the audience. They can submit their questions through Twitter at CGDev, hashtag CGDtalks, or email at events@cgdev.org or on YouTube. These questions will be consolidated by our events team. To allow us to go through multiple rounds of questions, I will request the panelists to limit the responses to about 5 minutes. Also, if any panelist, as I said before, wishes to make a short intervention in response to comments by others, please do raise your hand. So let me start first with Pauline. Singapore has quite a robust healthcare system. So what kind of reforms, adjustments that you think would be needed for the existing system to further enhance the well-being of the older population?
Thank you very much, Sanjeev. And Dr. Park, congratulations on a very concise and succinct presentation. Very well done. And the report is fantastic. So I urge the audience to get hold of a copy to read it. Singapore we've been projected to become a super aged society by 2026, not too far from now. So 1 in 4 of us will be above 65 in time to come. So I think at this point, our key concern is affordability of healthcare. We want to be able to continue to strengthen the capability and capacity of the public health system, which will cater to the needs of the post-65 group, right? So currently, many of us who are employed, we are protected by group medical insurance, and the coverage accords us, the privilege of seeking private medical care services. And many of us go that route because the wait times are much shorter, it's more convenient, etc. However, we've very soon realized that when we retire, most of us will have to rely on the public healthcare system, and this will I think present a big crunch on our healthcare system. So that's the one urgent problem that we have in Singapore. Thank you, Sanjeev.
Thank you for a very precise response to your question. And so we'll come back to these issues again. But Norma, let me turn to you now. You mentioned about the prevalence of non-communicable diseases, which are increasing in the region, and they are increasing in Malaysia as well. And that is on top of the incidence of depression among the elderly population. So how might this impact Malaysia's pursuit of universal health care, which is important? It's linked to what Pauline talked about earlier, but it's in the context of universal health care.
Thank you, Sanjeev. I would also echo Pauline's point about congratulate Dr. Park, the ADB and his team for coming up with such an insightful report. Now, to your question, Sanjeev, Malaysia's healthcare system is, we have two parallel systems. Both are equally developed and equally strong. One is the public healthcare, which is provided universally to all Malaysian citizens. Citizens only need to pay a minimum fee of USD, one US dollar, the registration fee. And on the other hand, Malaysia has the private healthcare as well, which is quite developed. And the percentage of private healthcare is about 30% of the healthcare expenditure. So out of pocket is about 30%, 36%, which is quite high. Now, we know that there is mandatory private health insurance in Malaysia, but it is not a large proportion of the population would have private healthcare. We also, in order to, you are right, pointing out that the increase in the prevalence of the three NCDs, and our MARS data, the Malaysia Aging and Retirement Survey, data shows that 60% of those respondents surveyed do have one or two types of NCDs. And the Malaysian government has realized this. So in order to address this, the Ministry of Health has come up with a white paper, a health white paper, and the main objective of this paper is to reform the national health system, especially advancing health promotion and disease prevention, and also to strengthen public health function, and also what we call trying to get intersectoral coordination and collaboration of health. So I think those are the efforts, Sanjeev, that the Malaysian government is embarking upon.
Thank you, Norma. So Eduardo, you're looking across countries. You're in a different position. So drawing on your experience of promoting well-being of elderly populations, how would you compare the efforts of developing Asian countries with those of advanced economies in this realm, and also at this level of development, because the income levels are lower in developing Asia compared to the challenges which advanced economies faced or started to face in this area?
Yeah. Thank you, Sanjeev, and congratulations again to the ADB and Dong Hyun and Aiko in this report. I would say that minding the diversity of scenarios of aging in the region, there are two key differences between the now aged countries and those who are in rapid transition to become aged societies. One is the speed of aging, and I think this is highlighted in the report too. Countries like Vietnam, Thailand, they have a 20, 30 years of window of opportunity for a transition than in Australia took 70 years, or in Western Europe took 100 years. No, so the urgency to adapt to population aging is pressing, much more pressing for developing countries now than it was for already aged societies. The second difference is you grow old or you grow rich before, which comes before. So I heard many policymakers in the region saying, oh, the problem is that we are growing old before growing rich, while the aged countries or advanced countries grew rich first and then became old, so they had the resources to adapt. And that's a fallacy. If that leads to non-action, that's something that has to be denied. You cannot argue that you cannot take measures to start adapting to population aging, adapting your health systems, your income security, because you are not rich yet. And finally, the developing countries, developing economies, developing societies can learn from the experience of developed countries. For example, Japan in the late 90s, early 2000s had a very hospitalized long-term care system, and the hospitals were bursting with patients, that belong not to the hospitals, not to the medical situations, but more to the long-term care situations. And then they changed the whole system. So we have to learn not to medicalize, which is a temptation for some countries. The other thing is not to delay measures. We learn from the ROK, Republic of Korea, for example, how the cost that they had for delaying adapting their systems, contributory and non-contributory systems, that represented that they had the highest level of poverty in old age in all OECD countries for several years, and I think still are lagging behind. So I think we need to learn from the experiences, things to do, things not to do from advanced countries. I think there are mutual learnings that can be enhanced.
Thank you, Eduardo. Dong-Hyun, you've been listening to these responses, and your research suggests that developing Asian nations will need to allocate more resources toward health and pensions. How do you propose these countries finance these additional expenditures, especially if demographic shifts dampen economic growth prospects? When you look at the World Economic Outlook projections released in April, they indicate that going forward, the growth prospects globally will be coming down, partly because of demographic trends. So, what is that one could do to offset these challenges?
Thank you very much, Sanjeev. In terms of how developing Asian countries can finance, right, the additional expenditures, most notably health and pensions and social protections as they experience population aging, right? It's a crucial issue. So this population aging, it does not create, but it certainly strengthens the case for strengthening tax revenue mobilization. So the point here is that developing Asia must mobilize taxes and expenditure for sustainable development, as well as population aging, right? I mean, even if the abstracting away from population aging, achieving the sustainable development goals for a more greener and more inclusive Asia requires vast public spending. Of course, to some extent, a greater spending efficiency, right, can help. But I think the consensus is more fiscal resources are needed if Asia is to move toward SDGs, and also to cope with this less publicized but no less important challenge of promoting the well-being of older Asians. So just to give you some numbers from an earlier study we did, an earlier ADB report we did, and Sanjeev contributed to that report. So estimates that benchmark current tax revenue against key economic characteristics suggest that countries in developing Asia could increase tax revenues from a pre-COVID average of around 16% of GDP by 3 to 4 percentage points on average. Okay, so there's a significant scope for raising more tax revenues, which is needed to finance the public spending, such as health, such as pensions, such as social protection, that Asian governments will need to spend more to promote the well-being of the large and growing population of older Asians. And last but not least, the region's governments must also prioritize growth-conducive public spending. More precisely, because population aging may dampen growth prospects, as you rightfully point out, precisely because of that potentially negative impact of population aging on economic growth, developing Asia's policies makers should give higher priority to fiscal expenditures that accelerate economic growth, such as infrastructure, such as R&D, and such as human capital. And the consequent improvement in economic growth should generate more tax revenues, which will expand fiscal space and allow Asian governments to spend more on aging-related expenditures such as health and the pensions, even as they cope with new large fiscal demands such as climate infrastructure. Back to you, Sanjeev.
Thank you so much. Let me now turn to Norma. Now, if you read the report, it talks about reaping the silver dividend. So how can Malaysia harness the potential of Asian workforce? Are there any policies that emerging economy like Malaysia can implement to leverage this demographic shift?
Thank you. The retirement age in Malaysia currently is 60 years old, and yet the average life expectancy is about 75 years old. So number one, maybe to look at extending the retirement age to reflect the life expectancy and the desire also by many older adults to continue working beyond the traditional age, retirement age. So this would enable not just a country as a whole or the economy would benefit by retaining these valuable skills and talent and experience among the workforce, and also would definitely boost the individual's financial security in later life as well. So the effort could be, and it is done currently in Malaysia, is to retrain and to reskill as part of the lifelong learning in order for the older Malaysians to be able to participate in the economy. And the government has also initiated the double deduction since 2021, where companies hiring workers older than beyond 60 can go for a double deduction. So this is also is one of the incentives. However, as pointed out by the report, and Dr. Park did not go into the detail of the report, that the in the developing Asia or emerging Asia Pacific is the large population, especially those aged 70 or 60 years and older, are in the informal employment. So creating a better social protection in the informal employment is one way to also protect the older persons and to ensure the well-being. But on the demand side, the government should work with the with employers to be more flexible in hiring older persons, because I think many older persons and would not want to stick to a 9-to-5 type of job, but perhaps would be more flexible in terms of hours and also the kind of role that they play in organizations. So these are some of the things that we propose to the government, and it has been looked into. So we hope that it will be taken up by the Malaysian government. Thank you.
Norma, can I ask a follow-up question to your response? How easy would it be to raise the retirement age in Malaysia? Because looking at the experience of other countries or advanced economies, this thing is fraught with all kind of political sort of opposition. So, how easy would be for Malaysia to raise retirement age without much opposition from different groups?
It will not be easy. It will not be easy because typically in Malaysia, the government, any announcement with regards to employment will start with the public sector. Yeah. So the public sector is based on seniority in terms of promotion, pay increase, and all that. So it's often felt that the longer you keep an employee or public servant stays on beyond a certain age, that will reduce the chances of the younger people to be promoted, and hence it's not welcome. And the private sector and from the evidence, it shows that it takes longer for the private sector to adopt the policies that have been implemented or taken up by the public sector. So what we're proposing to the government is a gradual process. A good example is what Singapore is doing, that you index it to the life expectancy and you give enough warning to both the employers and also employees to know that they are not able to retire at the age of 60. So in the next few years, they should be looking forward to the extension, either a year or 2 years from the original 60 years that they used to.
Thank you, Norma. We may come back to this issue again, but Pauline, Singapore is quite unique in various ways. It has immigration people come in, which tend to ease the pressure on the employment side. So, are there any insights from Singapore's experience that you could benefit other developing countries in the region, especially in this area, which will allow the countries to reduce the pressure from rising dependency ratio?
This is an interesting question. We are a very small country, right, Singapore? So we only have human resource and nothing else. So I think we've been able to succeed in the early stages of our nation building, primarily because we have a robust immigration policy, which has allowed us to toggle and adjust the number of entrants that we can invite to help us to partner Singaporeans, in growing our economy in the various segments. It's not sustainable, and we know it because we depend on surplus labor from our neighbors and the region. And we've now come to the realization that everyone is chasing limited labor, right? Because the TFR is a downtrend for all of us, some slower and some faster. So that's one, right? So looking at immigration itself, I think that it has served us well, and we will have to continue, right, to be welcoming, of those who are willing to come and partner us. But we can't rely solely on immigration simply because it's not sustainable. And of course, with immigration, one of the problems that Singapore has faced, especially during downturns, right, is the concerns with integration. Because we are a very, very small country. So we're always very mindful that our foreign friends will always feel they are welcome here and they're not going to be the target of resentment whenever there's a downturn, right? So we have to ensure that there are no enclaves that emerge because of segregation, because people tend to click with only those they're familiar with. I think in a way it was easier for us to do that because we're a multicultural country to start off with, right? So that has to be part of our DNA. But if I may, Sanjeev, with your permission, vary the question a little bit, because I've heard from my esteemed colleagues that one of the thing that we're doing now, all of us, is trying to just adjust to the retirement age, right? Because we are living longer, so therefore, how do we ensure that we are able to stay economically active for a longer period of time? So I think here one aspect, one reason why I congratulate Dr. Park is because the report has a fantastic, concise executive summary, right? And in that report, it highlights that all of us have a largely untapped human capital asset in our country, and that is the pool of post-65 or post-60, the retiree group. So I think moving forward, we need to really unlock the potential of this group. Now, in the past, right, the post-65ers, the retirees of, let's say, 2 generations ago or a generation ago, they may not have, the kind of asset that we valorize as much, and many of them may have be perceived as dependent, right? So therefore, old age dependency ratio becomes a statistic that was used to scare us every now and then, because that they were not adequately prepared for retirement. But if you look at the post-65s now, especially in a place like Singapore, right, this is a group of what we call baby boomers, and they are prepared for retirement, and they have assets, and they are a terrible loss to the economy if they just exit and are rendered invisible, right? Because they are now retired. So I think for a country like Singapore, and perhaps similar, nations that are similar to Singapore at the point of our trajectory, we need to not just adjust retirement age, because that is just merely fixing the cracks, right? But rather, we need to look at a transformation of work in totality, because older adults do not necessarily want to continue working till they drop dead. But we need them to want to continue to stay engaged, because they have capital assets that cannot be easily replaced. And in order for us to be able to leverage this, we really have to relook the way we engage labor, right? Currently, we engage labor based on very traditional assumptions that they will work from 18 to 55. And then the assumption is that past a certain age, you don't expect much from them anymore. They're going downhill. So we're always looking for younger, more productive labor who can run faster, carry more, etc., etc. But seriously, post-COVID, we are now acutely aware that we have a new economy, right? Have we sat down to think about what the new roles are? With technology, are we leveraging AI? Are we leveraging technology to transform work so that, things like manual work, they could be done by machines? So what should we use our scarce labor for? And how do we present extensions of retirement in a palatable way to those who can afford to retire, but we need to entice them to want to stay on at the workplace, because work is more than just income adequacy. Thank you, Sanjeev.
I think, Pauline, this is very relevant of what we are discussing. But perhaps I can ask you to elaborate a bit more. Remember, Norma said that it is going to be hard for Malaysia to be raising retirement age. And she gave the example of Singapore. What is that you have done which Norma would like to emulate?
It's interesting. Singaporeans are a very unique lot, because I think we are a very small country, right? So in many sense, I think in terms of policy shifts, it's easier for government to bring most of us along without, leaving gaps here and there, right? I mean, that's the advantage of being a very small city-state. So I think for us, we don't see much objections to, the retirement age in Singapore has been raised incrementally. So actually, it has recently, just in 2024, the announcement was that now we will raise the retirement age to 64, and re-employment age will also go up to 69. So there's retirement and then the re-engagement. And so, that's something that government sets out, and generally, I think whatever government sets out, private sector follows, simply because I think we are in the happy situation in Singapore where the realization that there is limited labor and we cannot just rely on immigration. So therefore, we've learned how to better use, I think, and leverage our extended longevity, right? So we do have one of right now, I think life expectancy in Singapore on average is about 85. But there is, unfortunately, in terms of health span, we are at about 75. So we are losing about 10 years. So that's something that we need to, try to fill the gap on. But with regards to extended retirement, I mean, we've targeted things like to make sure that we don't have a pension system anymore, but instead we have CPF, right? So there's a self-imposed self-saving. So past a certain age, the employer's contribution to CPF goes down, and like what Norma said, is to make to encourage employers to look at older workers as not more expensive, but perhaps less expensive. So we've looked at how much to adjust, in terms of the Central Provident Fund contributions from employers, and it's a difficult decision because we've also had to raise it, for those who are the young seniors, in the 50s, because we realize that at the reduced rate, they may not have enough sufficient for retirement, right? So these are difficult questions and difficult decisions. By and large, I think the Singapore workforce, there's not much objection, right, from the workforce. That the desire to work it has been quite healthy, and because we are such a small country, I think employers, by and large, they're learning, right? They're learning how to adapt to an older workforce. So the challenge now for us really is, not to just try to force the round pegs into square holes, but rather, create and curate, transform, right, the workplace so that the fit is not too difficult. And I think this is an exciting journey for us. I think that we look forward to how we can do this well, and in the process, I think we're learning from our esteemed neighbors around us, because I think this is a journey that all of us have to take. And in a way, I always joke that this is a good time to turn gray, because you have the majority with you, right, and the forces are with us. So we need to be able to hold hands, and do this together productively. Thank you.
Thank you, Pauline, for very elaborate response, very helpful response. Eduardo, so in what ways are you collaborating with governments across developing Asia to advance the well-being of older demographic groups? Can you highlight any notable successes or particularly effective strategies that have a wider applicability across countries?
Yeah, thank you, Sanjeev. If you ask me for ways in which we have been supporting not only the quest for current but also future older populations, I would say 4 areas. One is the promotion of social pensions, non-contributory pensions, which we started working in around 2005, and working with governments to design and implement social non-contributory pensions. How do you do that? You do that demonstrating the feasibility of those pension schemes by building scenarios of affordability, looking at projections of GDP growth. Then you see the adequacy, different scenarios of adequacy, and also age of entry, coverage of those pension schemes. And accordingly, we did that for Thailand, for Sri Lanka, for Cambodia, for several countries. And in most countries, it was shown that the universal approach with about 15% of the GDP per capita social pension, which is rather modest, could be no more than 1.5, 2% of the GDP in a sustained manner for 20, 25 years. So that's a way in which policymakers can see that it is a decision that can be affordable. It's not only politically favorable for them, but it's something that can go through different generations, goes beyond one single government. And so one concrete example was, aside from Thailand in 2008, that we worked with different forces, also in Myanmar. Before the coup, the military coup, we were working with the government, and we developed a system we designed with the government delivery of social pensions, universal, for a coverage of 250,000 older people before the coup. We don't know how that is continuing now. The second area is older people associations, community-based organizations, which is a way in which older people in the communities, especially rural areas, but not only in rural areas, can become engaged in a way in organizations that through time have been piloted, have been evolving, and have become multifunctional. So a social organization that is becomes intergenerational, but deals with healthy aging, conveying knowledge, connecting with the health systems. It provides income-generating activities, social connections, and provides home care to those who are in need in the communities, with volunteers in the communities. So the main advance in this area has been in Vietnam, where the government adopted this system, made it official, and is scaling it up to the whole country. So multifunctional, standardized, scalable, participative organizations. The third one is humanitarian interventions. We tended to see the typhoon, the Haiyan typhoon in the Philippines, or the Nargis in Myanmar, or the tsunamis in Asia. We saw that older people were disproportionately affected, but we also failed to see how older people could be a resource in the communities to support the recovery, not only the relief, but also the recovery of their communities. That's another way in which we work very closely with governments, and it's becoming policy in many countries. And the last one, I would say, is working in convening. We know that adapting to population aging, working on you can adapt the health systems, but if you don't work on gender issues, if you don't work on income security, if you don't work on lifelong learning in a coherent manner, you can be piecemealing policies that at the end of the day are not as effective as if you have an integrated strategy. So for that, we know that that's a role for multi-stakeholders. As governments are the main have the main responsibility in that, but it's also a whole of society, is academics, is international organizations, is social civil society organizations, community bases, older people themselves. So we are convening biennial meetings, to analyze how the adaptation to what experiences are there in different countries in Asia and the Pacific in relation to adapting to the demands of population aging. Is sort of an incentive and a way in which different stakeholders network, connect with each other. Because if a government organizes a meeting, gets only governments. If the UN gets only governments, academics get only academics, usually, no? Civil society only meet with civil society. But it is the aggregate force of all these stakeholders that can make a difference in how well policies are made and how well this adaptation to rapid aging is taking place. Over to you, Sanjay.
Thank you, Eduardo. Longshan, I'm going to turn to you now. So, we heard Pauline talk about some kind of changes in labor policies that would be needed to maintain the productivity and growth of the developing Asian countries. So, what other proactive labor market policies should the developing Asian countries implement to maintain the productivity and employability of the aging populations?
Thank you, Sanjeev, for the question. There are actually a number of different policies or policy options that the region's governments should pursue, right, to promote the employability and productivity of older Asians. One is to close the gap, right, between the pay or remuneration of older workers and their productivity. Because as the workers grow old, of course, in some areas they gain more, right, like experience, on-the-job experience, and on-the-job know-how and so forth. But we have to concede that in some areas their productivity falls, right? Physical productivity, obviously, but also to some extent mental, perhaps creativity and ingenuity. So in light of that, it would be helpful, it would incentivize employers to hire or retain older workers to close the gap between the pay of older workers and their productivity. In particular, if to the extent that productivity falls, of course, lowering the pay of older workers would, in line with the lower productivity, would incentivize employers to hire and retain more older workers. And another policy option or policy stream that the region's governments can pursue is to recognize that older workers in particular benefit a lot from job search and matching, right? Support in terms of government support in terms of job search and matching. And because we have to recognize that older workers are likely to struggle in finding jobs, especially those jobs that are outside their usual sector and occupation. So what this means is that governments should ensure that older workers are served by mainstream placement organizations and public employment services. And third, age discrimination, which certainly exists, right, around the world, but also in Asia, should be addressed with strict legislation. And then fourth, investing in high quality education, especially lifelong skills development, is very important, right? So that the older workers remain on top of their game. By the way, in this connection, I would like to point out or refer to a research paper, a paper that was published in a journal that I did with some academic co-authors. It was published last year. And that paper, it basically examined the relationship between the productivity of older workers and technology. And the headline finding, empirical finding from that paper was that contrary to widespread conventional wisdom, older workers are not reluctant to absorb, learn new technology, and to leverage that new technology to improve their productivity. For example, ICT, right? Digital technology skills. To the contrary, they were very much able to improve their productivity by learning and use new technology. Okay, and last but not least, I think some countries already formally recognized through certification system, right? The skills acquired by older workers on the job, right? And outside the formal education system, I think it would be productive. It would be useful if all Asian countries considered formally certifying these kinds of on-the-job skills that older workers have, that they have acquired during the course of their working career, so that would also help their employability. Back to you, Sanjeev.
Thank you, Donghyun. Can I ask a question on what you said earlier? You said that the wages of older workers will then decline after they retire because of lower productivity. How would you induce older workers to go back to work if they are going to receive lower wages?
Oh, I think for many workers, it's not so much the pay, right? But it's the reward, the sense of being socially useful, contributing to society. I think that's a powerful factor. I mean, for many people, I know for sure that that's a powerful factor. So I think a little reduction in salary, I don't think that's going to deter older workers who do want to work more. Now, I do want to mention one additional factor that was not touched upon in the discussion so far, and that's the duality of Asian labor markets and Asia's economies more broadly. That's the duality between formal sector and informal sector. Of course, informality, right? It does not apply so much to countries like Singapore and some other high-income economies such as Korea. But for the most part, the prevalence of informality is very high. And in that sector, right, in the informal economy, in the informal labor market, older workers who are working in the informal economy, the issue of retirement age and whether retirement age is outdated in light of older Asians improving longevity and better health and so forth is somewhat not relevant, because there, especially in rural areas where many rural workers are concentrated, the issue is they work until as long as they can, right? Or to put it crudely, they work until they drop out of sheer economic necessity. So I think, of course, you need different policy options to address that issue. For example, by facilitating financial credit or access to financial credit so that they can buy tractors, let's say, so they can engage in less physically demanding work, and by providing better social protection in most cases. There's very limited social protection for these informal workers. So I think when we talk about mandatory retirement age, that's fine, but we have to remember that applies primarily to the formal sector. Back to you, Sanjeev.
Thank you. I think that's clear. And talking about the informal sector, perhaps we can go to Eduardo. We heard Donghyun talk a little bit about the possible measures that the governments could implement to protect older workers in the informal sector. What policy measures, in addition, you can think of that the developing Asian nations can implement to reduce the vulnerability of elderly workers? And, you know, in the informal sector, that's a big issue, and the incidence of poverty among them is also relatively high.
Thank you, Sanjeev. Indeed, I think Donghyun was explaining very well that in a large proportion of older people work as long as their functionality allows them, as long as they are able to work. And this reduction in work, according to some researches, is gradual. No? Mm-hmm. So one of the points that can be done is support the functionality of people in the informal sector, all workers, but especially those in older workers. How do? You do that by conveying healthy aging practices, by community support, by two things that Dong Hyun mentioned. One is giving access to lifelong learning, to skills, to reskilling older workers, because somebody who is old, classified as old, 60, 65 years old, still has the possibility of being active in the productive sphere for 10 years, perhaps, or even more. So the opportunity to being reskilled is very important. The other is access to credit. Sometimes, street vendors can, or somebody who is with a sewing machine needs a small credit, will allow that person to improve their productivity, their income, working in the formal sector. But the other thing is that Asia has a very low level of social protection in general. One thing that we need to highlight that is important for the informal workers, informal sector in general, and in particular older workers in the informal sector, is universal approaches to social pensions, because an older worker doesn't have income security, in the sense doesn't have access to pension, to social security, medical care, etc., etc. So universal social pensions is something that is doable, is feasible, and it can be a big boost to provide a minimum income for those who are in the informal sector. And the other is universal health care, access to universal health care. Some countries in developing Asia have this access to universal health care, and within the universality, you have to tailor, develop, design the health systems in a way that they can deal with non-communicable diseases that are crucial for are the majority of the maladies affecting older people, older workers. So that's the things that you need to think when you talk about supporting older workers in the informal sector. Over to you, Sanjeev.
Thank you, Eduardo. Pauline, another issue that the policy paper from ADB touches upon is the weakening of the family support systems over time. How might this affect Singapore's healthcare budget? Because long-term care, would it be absorbed by the healthcare budget? Would it be part of the social protection network, or would it be part of the healthcare? How do you foresee this happening in case of Singapore?
So I think in Singapore, one good thing going for us is we have a pretty strong public health system, right? And that's why when I started off, I said one of the things that we have to ensure is we protect the public health system to make sure that it is ramped up to be able to receive a super aged Singapore. Because as long as we're able to do that, then affordable healthcare is accorded to Singaporeans. But I think more interesting for us really is the transformation of society as a whole, right? Being an Asian society, when I was growing up, the norm was you have kids, you grow up, you get married, you have kids, so that your kids will look after you, when you're old and gray, right? And so the family takes care of its own. And I think in a way we relied on it a little bit too much, and that's why we have a lot of catch up to do. When suddenly we woke up one day and oh my goodness, the Singapore family has transformed, has changed, because we now have smaller families, and even if we are married and we have children, we can't be sure that the children are even on the same piece of land that we are, right? Because we are such a global, a society now. So I think we've come to the realization, and it was for my generation, we've accepted it. For my parents' generation, I think it was a really hard, change that they had to embrace because that was a generation. So my mom, right, she's in her 90s. Her generation was a generation who took care of their older adults. Because there was still a full-time homemaker, in a family, and women continued to play, multiple roles, right? And they were primarily the caregivers. And then her generation saw the transformation of the family, where, by the time her generation got old, their children, if they had children, were too busy trying to just look after ourselves, right? So I think, the notion of filial piety was challenged, right? We had to recontextualize it, and we had to argue that you can be a filial child even if you don't live with your parents, right? And so forth. So that being the backdrop, I think that now with our extended longevity and the transformed family structure, there are three strategies that I think generally, we propose that we have to adopt as we prepare for this new super aged society that we will call home, right? The first, of course, is to be able to promote pro-health norms and practices, because we are going to live longer, so it is critical that we improve health span. Right? We close that 10-year gap that we suffer now in Singapore so that we can leverage extended life expectancy. And with good health, that's the primary basis for the other aspects, of well-being, as is well documented in Dr. Park's report. Right? And then the second would be to again, the transformation of society is supremely important here, because we cannot just say that we are a super aged society and then the same old happens and we continue to proceed life as per normal. Processes have to change, and one important process would be how we use our land space, right? So for a small country like Singapore, the second important thing that we have to do really is to transform the built environment and infrastructure so that we can enable aging in place, right? If we can live longer, healthier, and we are enabled and empowered to continue living independently in our homes. And in the process, we learn to unlock community assets. So you may not have your children living next to you and in your household, but you can learn how to get to know your neighbors. And the neighbors become your primary asset. So familiar ties, take on a different form. And in that way, I think we're trying to do this, right? We will derive self-help ecosystems in our neighborhoods, right? And then finally, thirdly, I think, and this is something that we tend not to do so much in a place like Singapore, where we continue to push for, the retirement age to keep inching up, and we just focus on the fact that, oh, I'm still going to be working, I'm still going to be able to, stay engaged, and then we lose important time that should be spent on preparing for retirement. You have to plan ahead. You have to plan ahead for how we want to live out our golden years, particularly the quality of life that we envision in the fourth stage of our life cycle, right? So it's I think for a long time in a place like Singapore, we don't talk about retirement. Retirement almost became archived because we were focused on, telling everyone that we can continue to work. We're good, we're strong, we can keep going. But in doing so, I think we risk not being prepared for retirement. And preparation for retirement starts not when you're 60, not when you're 70. It starts when you're in your 40s, right? So a short note about ROSA, right? This is the center that I run. So we form our outcomes, our proposals from evidence-based outcomes. So we host a representative cohort of older adults 50 and above, and we do monthly surveys, right? So anybody out there, if you want to work with us, please just drop me a note. I mean, we are very, very happy to work with our colleagues globally and learn from you, right? So that we can co-curate the new world together. But we've decided that starting at 50 is too late. So in the next phase of ROSA, we're growing to extend the cohort to 21 and above, because we have to take a life course approach. Thank you so much, Sanjeev.
Thank you. So we are left with 5 more minutes. And so I'm going to ask Norma just to outline for us the initiatives that the Malaysian government has undertaken or plans to undertake to enhance the well-being of older population groups. Will they suffice? Are there any lessons for other nations from your experience?
There are several initiatives, Sanjeev, that the Malaysian government has formulated in order to ensure or to support the well-being of older population. They have come up with the National Senior Citizens Policy and Action Plan, and within that is about ensuring that to have older population to have access to healthcare in order to enhance the quality of life of older Malaysians, but also to promote active aging. Yeah? So the government also supported or empowered not just agencies or centers created by the government, but also working with communities, religious organizations, and also NGOs in order to encourage and support wellness or social centers that older persons can visit. But I think what has become the main concern among Malaysians, especially since the COVID-19 pandemic, was the lack of economic security among the older population. So although there have been efforts by the government to increase the old age pension, which is targeted, and it is only about, it covers only about 4% of the older population, that has been increased. But the cover rate or the percentage of the population that's covered under the old age pension is minimal, as I mentioned, 4%. So the proposal on how do we increase the old age income security among the older population. This is one of the initiatives that I think our center and a few of our like-minded, including the Central Bank, the EPF Malaysia, and also several other organizations are working towards getting the government to provide a wider coverage or getting the wider population to access income security. So what the government has done recently is first to start with the EPF, the Employees Provident Fund, that in the past, you are able to withdraw 70% of the savings at the age of 55. So what the EPF has managed the government, persuaded the government to do is to have the 75% of the contribution or savings to be locked as an income security or as a drawdown of pension-like system until the age of 80. So this is in order for, but of course, the other aspect is that 10% of the EPF contribution, which is in total 24%, would enable or contributors would be able to withdraw anytime. It's just like you go to an ATM, you can withdraw that. So that's the sweetener in order for us to lock the 75%. And this is as a result of the issue of lack of income security for older population. If you ask me, Sanjeev, whether this is sufficient, of course it's not. We can do more. So our center, and like I said, our partners are working towards proposing a stronger social safety or social protection for older population, for older Malaysians. Thank you, Sanjeev.
Thank you, Norma. This is the last question. We've already almost close to the end, but so if you can be a little brief. I'm going to ask a question on which Pauline elaborated a lot about. She said that older population should start planning for retirement at a younger age. So, how can citizens plan and prepare for their retirement years? What kind of steps developing Asian countries can implement, facilitate?
Hi, Sanjeev. Yeah, Sanjeev, that what question was directed to me, right? Okay.
Right.
Yeah, okay.
Sorry,
yeah, very briefly, we are almost out of time. I think the most important contribution of government is to make the people aware, making all Asians aware that we will be facing a rapidly different demographic landscape in the near future. And some countries are already facing that very different landscape today, right? Countries like Korea, right, which is experiencing which is at the very advanced stage of aging. So of course, older individuals themselves need to do a lot to prepare for that. For example, because health in old age, for example, it's not just the outcome of what you do when you're old, but it's the result of lifetime of choices and behavior, right? Eat well, do exercise, and more generally, lead a healthy lifestyle. Similarly, likewise, in terms of planning for retirement, you need to save resources today, right? So that you can have an acceptable level of living, quality of life when you're retired. So I think that's what the governments have to do. Of course, there are more concrete and specific things governments can do to help older people. For example, making it easier for them to make financial choices by reducing the bewildering array of sophisticated, fancy financial products to a more limited range of simple and clear savings product. That will, of course, help to nudge current and future cohorts of older Asians, to prepare financially for tomorrow, for example. Back to you, Sanjeev.
Thank you, Gogal. That completes our discussion, but let me pull out some of the key things which have come out from the discussion. Although we have exceeded our time by 1 or 2 minutes, but I suppose we can go another 2 minutes. So this is the paper which ADB has produced. Is clearly an important paper, especially at this juncture. And,
sorry, Sanjeev, can I make one correction? It's not a paper, but it's a big report based on like 15 background papers. Okay, back to you, Sanjeev. Sorry.
Okay. The ADB report, I stand corrected, is an important piece at this juncture. And so it raises a whole lot of social and fiscal issues. And this is coming at the top of the fiscal challenges which region is facing, of ensuring debt sustainability, of maintaining fiscal balances in shape. So we, what kind of policies could these countries implement? Of course, looking at the experience of Malaysia and Singapore, the policies would have to be country specific. But few sort of common features stand out. For example, social pensions, which was emphasized a lot by Eduardo. I think that's an important issue, which it deals with the poverty in the informal sector, but also deals with poverty in general. And of course, some kind of proactive labor policies, such as helping older population in job search, giving some access to credit, and imparting some training in better skills, helping in job search, can allow these people in that age group to join the labor force or stay in the labor force for a longer period of time, to be able to offset the negative consequences of rising dependency ratio. And of course, behind this lies the need for more fiscal resources. And Dong Jun talked about raising more revenues, and some of the work that we had done for Indonesia, we came up with a number which Dong Jun cited, 3 to 4% of GDP, which potentially can be raised. That number actually may be somewhat on the lower side, because the IMF just produced a piece of paper for the both low-income countries and for the emerging market countries, indicating that the potential is somewhere in the region of 9% of GDP. Of course, 9% is over a longer period of time. And so there is potential, and it means that any policies that are discussed on the social side, on the pension side, are combined with the policies that expand the revenue base of the economies. And that also means that we have to ensure that the money that we mobilize is spent well, because if it is not spent well, and we do know that countries have some inefficiencies, that means the additional resources that we mobilize are not going to give you the same kind of bang for buck that you're looking for. And as Dong Jun pointed out, if you are able to spend money on areas which promote growth, that will then generate fiscal dividend over time. So with this, I'd like to conclude by thanking you all for joining in this very interesting discussion. Thank Dong Jun for the paper, and thank you very much. And bye. Thank you.